All right, in this explainer, we're tackling something huge. India's ambitious plan to use artificial intelligence to basically rebuild its entire healthcare system from the ground up.
I mean, that's the big question, isn't it? It's right at the heart of India's entire strategy for the future. Can AI really be the architect of a whole new era in public health? Okay, let's dive right in and find out. So, before we can even talk about the solution, you've got to understand the problem. And the challenge facing India's healthcare system is just on a whole other level. It's under immense, almost unimaginable pressure. Just let that number sink in for a second. 1.4 billion people. That is the number of citizens India's healthcare system is responsible for. The logistics of that alone are just staggering. And the mission itself is crystal clear. It's about providing quality, accessible healthcare to every single person, no matter who they are or where they live. This isn't just a lofty goal. For India, it's a national imperative. So, how in the world do you even begin to tackle a challenge of that magnitude? Well, according to top government strategists, you bring in a completely new kind of architect: artificial intelligence. And listen, we're not just talking about a simple tech upgrade here. This quote from NITI Aayog, which is the Indian government's central policy think tank, says it all. They see AI as a fundamental piece of the puzzle for a complete system overhaul. Now, here's a really crucial point to get. The vision isn't about replacing doctors with robots. Not at all. Instead, AI is meant to be an intelligent assistant, a super powerful tool that augments and basically supercharges what our human medical professionals can do. Okay, so that's the grand vision. But what does it actually look like on the ground? How is this new architect really going to help build a better healthcare system? The plan really breaks down into three major moves. First, you've got to revolutionize diagnostics to catch diseases way earlier. That then leads to step 2, which is enhancing treatment by making it more personal. And finally, step 3 is all about streamlining the massive back-end operations to make the whole machine run more efficiently. Let's just focus on diagnostics for a second. Think about the millions upon millions of X-rays, MRIs, and lab reports created every day. AI algorithms can sift through all that data at unbelievable speeds, spotting these tiny, subtle patterns that could be early-stage diseases, patterns that even a highly trained human eye might just miss. And what this does is create this amazing, positive feedback loop, right? The AI helps doctors, which makes them way more efficient. More efficient doctors can then help more people, which moves the whole country closer to its big goal of universal health coverage. It all connects. Now, this whole AI-driven vision isn't just some idea floating around in a vacuum. It's actually being woven directly into the fabric of India's national digital health strategy. Let's see how that works. That strategy is called the Ayushman Bharat Digital Mission, or ABDM. And the goal is pretty straightforward: create a single, unified digital health ecosystem for the whole country. So you can imagine a system where your health records can seamlessly and securely follow you to any doctor or hospital you go to. And if the ABDM is the digital superhighway, then AI is the engine that's designed to power the whole thing. It's the intelligence layer that will analyze the data, provide insights, and make the entire system smarter and more responsive. So the blueprint is there, and the engine has been identified. But what does it actually take to build this future? What are the hurdles? And, what's the ultimate prize? Look, nobody is saying this is going to be a walk in the park. There are some serious hurdles to overcome. We're talking about massive concerns around data privacy, the challenge of getting enough high-quality health data to train the AI, and of course, building the robust digital infrastructure to support it all. But the hope, the light at the end of the tunnel, is achieving universal, efficient, and accessible care for everyone. You can kind of see the whole strategy unfolding over time here. Right now, we're in the vision phase set by NITI Aayog. The next big step is that deep integration of AI with the national digital mission. But the long-term goal, well, that's even more ambitious. And this right here, this is the real end game. The ambition isn't just to use AI to fix healthcare problems at home. It's to leverage this huge domestic project to become a product nation, a global leader that creates and then exports innovative AI healthcare solutions to the rest of the world. Which leaves us with this one final thought. AI might be the architect holding the perfect blueprint, but building a truly fair system that works for every single one of those 1.4 billion people, well, that's going to take more than just code. It's going to require trust, infrastructure, and an absolutely monumental human effort. The design is there. The construction is just beginning.